Good afternoon, dear learners. Myself, Yogesh Kanade, lecturer at DCS Institute of Pharmacy, Devpur, Dhule. In today's topic, we are going to discuss about the diseases caused by Mycobacterium. Mycobacterium or Mycobacteria are the transition forms between bacteria and fungi. Transition forms means the characteristics of Mycobacterium lies in between bacteria and fungi. Mycobacteriums are generally characterized by its non-motile in nature, it does not have sporulating rods, and it does not get discolorized when treated with acid. Whenever a mycobacterium is reacted with an acid, the color of acid doesn't changes, that is decolorization does not takes place, therefore it is known as acid fast bacteria. There are two diseases which are caused by mycobacterium. Mycobacterium causes tuberculosis, leprosy in human beings. The various species of mycobacterium like Mycobacterium tuberculosis, Mycobacterium leprae are responsible for causing tuberculosis and leprosy in human beings. First of all, we will discuss about tuberculosis. Tuberculosis is a chronic communicable disease caused by Mycobacterium tuberculosis. It is a disease of respiratory transmission. A healthy person will get infected when he comes in contact with the environment which has been contaminated by tubercular bacilli. Means in an environment which contains a mycobacterium tuberculi, and a healthy person when comes in contact with such contaminated environment, he suffers from tuberculosis. These tubercular bacilli which are present in the environment gets expelled from the infected person through the modes of coughing, sneezing, shouting and singing who is having active tuberculosis. When these bacilli are inhaled by a healthy person, they are inoculated into the respiratory bronchioles, and in bronchioles it is generally towards the apex of the lungs. When these microorganisms are multiplied to the sufficient extent, in our body antigen antibody interaction is evoked by cell mediated T lymphocytes. Tuberculars then formed due to accumulation of macrophages at the site of the infection. This leads to post primary infection. Means the tubercular bacilli which is inoculated means the growth and multiplication of tubercular bacilli is going to take place in the bronchioles, particularly at the apex of the lungs. When this tubercular bacilli has been sufficiently growth, in our body antigen antibody reaction takes place. This antigen antibody reaction converts the active tubercular bacilli into tubercles. These tubercles are present at the site of infection. Means from the inhalation of tubercular bacilli up to formation of tubercles, this is known as post primary infection. When there after formation of tubercles, these tubercles is going to break down when the immunity system of the person becomes weak. When these tubercles break down under the conditions of weak host defense mechanism means ज्यावेळेस ह्युमन बिंग्सची इम्युनिटी पॉवर कमी होते तर जे ट्युबरक्युलर्स तयार झाले त्याचं ब्रेकडाऊन होतं, अँड आफ्टर द ब्रेकडाऊन it gets circulated through the lymph and blood to the different parts of the body, and the other parts also gets infected. एकदा ट्युबरक्युलरचं ब्रेकडाऊन झाल्यानंतर आपल्या लिम्फ नोड्स आणि ब्लड सर्क्युलेशन थ्रू आपल्या शरीराच्या वेगळ्या वेगळ्या पार्ट्सला ते सर्क्युलेट होतं आणि देन इट स्टार्ट्स द इन्फेक्टिंग द हेल्दी ऑर्गन्स. This active bacilli during coughing may be either swallowed by the same patient, resulting into the infection of his alimentary tract, or this active bacilli may be inhaled by a healthy adult, resulting in the infection of his trachea, larynx, or bronchi. Cases of tuberculosis are more possible in the conditions of overcrowding and poor personal and public hygiene. ज्या ठिकाणी overpopulated area आहे where they are do not having a proper hygienic conditions, at such places there are maximum chances that the person may suffer from tuberculosis. The name itself communicable, it is going to be communicated from one person to another person. What are the symptoms of tuberculosis? The main symptom is cough. The cough will have for more than 3 weeks. That means if a person is having a cough for more than 3 weeks, there are chances that he may suffer from tuberculosis. Tachycardia, that is increase in heart rate. Cyanosis. Now what is cyanosis? Cyanosis means a dark bluish coloration of skin and mucous membrane takes place due to deficient oxygenation of the blood in the lungs. ज्या व्यक्तीला ट्युबरक्लोसिस झालं आहे त्या व्यक्तीमध्ये आपल्या लंग्समध्ये जे ब्लड प्युरिफिकेशन होतं, द ब्लड इज नॉट प्युरिफाईड टू अ सफिशियंट एक्सटेंड, therefore dark bluish color spots on the skin and mucous membrane gets developed, that is known as cyanosis. Respiratory failure. Calcification means the tissues will become hard due to deposition of precipitates or larger deposits of insoluble calcium and magnesium. जे टिश्यूज आहेत ते हार्ड होतील का, तर insoluble calcium and magnesiums are deposited into this parts of tissue, therefore the tissue is going to become hard in nature, that we call as calcification. Fibrosis, anorexia and weight loss, these are the symptoms of tuberculosis. Depending upon the site of infection, tuberculosis is classified as pulmonary tuberculosis, genitourinary tuberculosis, tubercular meningitis, miliary tuberculosis, and the last one, that is extrapulmonary tuberculosis. Pulmonary, the name itself, it is going to affect your respiratory tract. Genitourinary means that is GIT as well as urinary tract. Tubercular meningitis, that is related with your nervous system. Miliary tuberculosis means when the widespread of tuberculosis has been taken place in our body, means the various organs has been infected by this Mycobacterium. Such kind, it is referred as miliary tuberculosis. Extrapulmonary tuberculosis means a person who is suffering from AIDS or HIV, and the same person is having a pulmonary tuberculosis, then we refer it as extrapulmonary tuberculosis. Now the most important thing, problems faced during chemotherapy of tuberculosis. A person who is suffering from tuberculosis, to such persons when we are using the drugs or medicines, What are the problems which are faced by the physicians or doctors? That we are going to discuss here. Problems faced during chemotherapy of tuberculosis. Chemotherapy of tuberculosis faced some problems because of slow growth of Mycobacterium and its intracellular location. The tubercular bacilli which has been inhaled by a person, this tubercular bacilli, the growth and multiplication is very slow, and its growth and multiplication takes place in the bronchioles, that is in your lungs. Therefore, that is the first problem faced, that is slow growth of Mycobacterium. Second, that is the intracellular location. Next one, since the disease is chronic by its nature, the therapy needs to be continued for at least 1 to 2 years depending upon the type of cases. Now, tuberculosis is a chronic in nature, therefore, long term therapy is needed, and this therapy may vary from 1 to 2 years. That is the next problem which we are going to be faced in treatment of tuberculosis. And whenever a long term therapy is given in treatment of a disease, we cannot depend upon a single drug, because if a single drug is used for a longer period, there are chances that the mycobacterium may develop a resistance towards that single drug. Resistance means the drug will not have any effect on mycobacterium. Therefore, in case of tuberculosis, instead of using a single drug, we go for using combination of 2 or more drugs in treatment of tuberculosis. Now, when 2 or more drugs are used in the treatment of tuberculosis, there is another problem faced, that you have to use 2 or more drugs which are having different side effects, or which are having different pharmacologic, means if you are combining such drugs which are having same toxicological or side effects, then it is going to affect the health of the patient. Therefore, the obvious solution to this problem is to use combination therapy. When 2 or more effective drugs are used in combination, resistance will not develop. Drugs which are used in combination should not have similar toxicological profiles. In tuberculosis, the choice of drug is dependent upon the type of disease and some patient related factors. These are the various problems which has been faced when you are treating a patient with your chemotherapeutic agents. The next topic, that is leprosy. Leprosy is also a chronic communicable disease caused by Mycobacterium leprae. Leprosy, it is also known as Hansen's disease. It produces nodules on the skin and loss of sensation in the affected region. This disease develops very slowly over a period of years. It is a disease of peripheral nerves, but it may also affect the skin and sometimes eyes, mucosa of upper respiratory tract, muscles, bones, testes, nose, ear, feet and hands. Once the Mycobacterium bacilli has been multiplied to the sufficient extent, antigen antibody reactions are evoked. These reactions may occur suddenly, in the absence of a drug, or in the presence of antileprotic drugs. These hypersensitive reactions are occurring not as a result of allergy to the drugs, but it should be considered as an allergic reaction towards the metabolic products of Mycobacterium bacilli. Such reactions are known as Lepra reactions. Then, types of leprosy. Based upon the area which has been infected, area means the part of the body which has been infected by Mycobacterium lepra, and the intensity, that is the severity of lepra reactions. There are four types of leprosy: indeterminate leprosy, tuberculoid leprosy, lepromatous leprosy, and borderline leprosy. Let us discuss one by one. The first one, indeterminate leprosy. This type of leprosy takes place in the early stages of the disease where Mycobacterium has not been multiplied to the sufficient extent to induce lepra reaction. This early form of disease is known as indeterminate leprosy. Indeterminate leprosy is characterized by some localized hypopigmentation of the skin and loss of sensation. If the treatment, that is proper treatment, is not given in the indeterminate leprosy, then or healing does not occur, this indeterminate leprosy may progress towards tuberculoid leprosy or lepromatous leprosy. इंडिटर्मिनेट लेप्रसी म्हणजे काय? ज्यावेळेस मायकोबॅक्टेरियम लिप्रे हा सफिशियंटली मल्टिप्लाइड झाला नाही आहे, कारण की जोपर्यंत सफिशियंटली मल्टिप्लाइड होत नाही तोपर्यंत लिप्रा रिॲक्शन होणार नाही. लिप्रा रिॲक्शन म्हणजे काय? दॅर इज अन रिॲक्शन ऑफ युअर अँटीजन अँड अँटीबॉडीज. आणि इनडिटर्मिनेट लेप्रसीमध्ये जर तुम्ही किमोथेरप्युटिक ड्रग्ज यूज केले नाही किंवा अँटीलेप्रॉटिक ड्रग्ज जर दिले नाही तर पुढे जाऊन काय होईल? This indeterminate leprosy will get converted into tuberculoid leprosy or lepromatous leprosy. Now let us see the second one, tuberculoid leprosy. In this, skin and peripheral nerves are involved, resulting in motor and sensory changes in the affected area. It is characterized by the presence of infection in restricted area and less pronounced lepra reaction. It means that very few number of microorganisms are present in the infected area of the skin. It gives lepromine test positive. Lepromine test means it is a diagnostic test which has been used to diagnose whether the person is suffering from leprosy or not. Next one, that is lepromatous leprosy. In case of lepromatous leprosy, the skin will get thick, oedematous in nature, painless nodular lesions which may become narcotic and ulcerate, releasing large number of mycobacterium. This form of leprosy requires multiple drug treatment and prolonged therapy. It gives lepromine test negative. And the last one, that is borderline leprosy, or it is also known as dimorphous leprosy. Borderline leprosy of the disease has some features or characteristics or symptoms of the tuberculoid and the lepromatous type of leprosy. These forms of leprosy, which are lying between tuberculoid and lepromatous form of leprosy, are known as borderline or dimorphous leprosy. In today's lecture, we have studied about Mycobacterium, disease caused by Mycobacterium, that is tuberculosis and leprosy. Tuberculosis is caused by Mycobacterium tuberculosis. Leprosy is caused by Mycobacterium leprae. their symptoms and types of tuberculosis and leprosy. Thank you.